diagnosed with heart failure either based on the symptoms that I'm having or with evidence. What do you do next? How do you tackle this? So when I first have suspicion that someone has heart failure based on their symptoms, the next thing I'm going to do is get an echocardiogram, an ultrasound of the heart. And the reason behind this is I want to see what type of heart failure it is. Heart failure can be due to an issue with the heart not squeezing appropriately. This is known as systolic heart failure. It can be an issue due to the heart not relaxing appropriately. This is known as diastolic heart failure. So when someone has the initial symptoms of it with the weight gain, with the shortness of breath, getting an ultrasound is going to be helpful. If it's due to the heart not squeezing appropriately, the most common cause of this is due to blockages, so we need to do a cardiac catheterization to look for blockages. This entails running a catheter up the arm or up the groin to look for blockage. If there's blockage, we open it up with a stent. If there's several blockages, we have to consider open heart surgery, coronary artery bypass graft, or CABG. If there's no blockages, then we have to look at other potential causes. High blood pressure can be a cause, alcohol can be a cause, autoimmune conditions where the body attacks itself can be a cause too. Infiltrative disorders can be a cause of it, things like amyloidosis, sarcoidosis also too. So everything starts with the initial echocardiogram to make the diagnosis of systolic versus diastolic, and then we do further testings. And that's to make a diagnosis. How do we treat it? Because heart failure leads to backup of fluids or blood, you can have a lot of swelling, so we give medications to help with that swelling. It makes you pee a lot. Medications to help the heart potentially squeeze better in the future, things like aldosterone receptor blockers. There's a newer one called Entresto. Beta blockers to help slow the heart down, where it can squeeze more effectively at a lower heart rate. But it's a full repertoire of treatments with lifestyle changes, with medications, and with echocardiogram and possibly a heart catheterization, but a continual follow-up with your medical provider.